Hi, Dr. Ian here, and I want to talk about holistic orthodontics, or in our case what we'd like to call something called forward dental orthopedics. And holistic to us means treating the whole and not just the narrow, pun intended. In contrast to normal orthodontics, we don't believe that crooked teeth are just crooked, and we search for the origin of the problem and address that first in a more holistic way. There are mostly functional reasons for the cause of malocclusions or crooked teeth, and we also believe that those functional reasons are not, if they're not addressed, there would be a large risk for them to reoccur and for relapse or going back to the original state of the crooked teeth is what actually happens all the time with traditional braces. Now, crooked teeth are just one of the symptoms of a much bigger problem, a more important problem. And this, looking at this bigger picture, is the basic definition of what holistic is. In other words, the aesthetics, albeit very important to the patient, and the reason they look for the treatment in the first place, is just part of the problem, one of the symptoms. And there's other problems that relates to that. And the single most important cause of crooked teeth is the lack of nasal breathing. And this may seem like a very small problem to the layperson, and I understand that point of view. And that's why I'm passionate about getting these videos out, to kind of get the message out there that this is a very important issue and a very important problem. And more information is coming out about that exact thing, and as these newly published books will show, about how much our breathing relates to our health. And for this video, I'd like to talk about how the body adapts to our breathing, and it kind of sacrifices long-term health for short-term survival. So you adapt, but not for the better. And the risk is that it has become so commonplace that it's not seen as a problem because everybody's in the same boat. That is not, however, how I feel it should be. And there's a large body of evidence now linking the lack of nasal breathing to problems like ADHD, ADD, and other behavioral problems, sleep disorder breathing, and that includes children, which never seems to have been a problem in the past. Gastric disturbances like reflux, dental decay and gum infections, TMJ problems or TMD, daytime fatigue, and many others. However, the most relevant for this video is the large, pronounced effect that the lack of nasal breathing has on the development of the jaw bones and jaw structures, and the resulting of crooked teeth because of that. And this is kind of a chicken and the egg analogy, in that the jaw gets restricted because of lack of nasal breathing, but then the restricted jaw creates more lack of nasal breathing, and this cycle kind of continues. And we believe in breaking that cycle and setting you on a pathway to improve the situation. And we employ methods to get your jaws to develop through extraction-free braces and jaw development. And there's so much more I want to talk about, the link between teeth and jaw position and the effect of our general health, but that's for a later video. And Dr. Ian, and thank you for listening.